At a time when national security and anti-terrorism initiatives consume significant governmental resources, it's imperative that the most effective initiatives be widely recognized, disseminated, and adopted. The Mitretek Innovations Award in Homeland Security represents an important collaboration between Mitretek Systems and Harvard's Ash Institute for Democratic Governance and Innovation to identify, disseminate, and encourage the replication of exemplary government and public-private sector partnership initiatives and highlight the leaders responsible for them. The 2006 Mitretek Innovations Award in Homeland Security winner, the Birmingham Regional Emergency Medical Services System, BREMSS, is an effective model of an interjurisdictional integration effort that has the potential to increase our homeland security at the local, state, and federal levels. BREMSS is located in central Alabama. It serves 6 counties, including over 60 different municipalities and the city of Birmingham, with a total population of 1.5 million. 1,500 paramedics and 1,000 EMTs function in this all-ALS system. Over 180 different EMS agencies, 19 hospitals, and over 20 9/11 centers make up this EMS system. BREMSS operates a regional trauma, stroke, divert, and biochem terrorism monitoring system to assure that patients are always routed to the closest available hospital to treat their particular emergency. The system utilizes LifeTrack, which is a state-of-the-art technology that directs the efforts of an emergency medical system to efficiently deal with emergency room, trauma center, stroke center availability, as well as hospital diversion coordination. The system monitors for biochem events and assists in mass casualty incidents for the participating 19 hospital network.
Approximately 10 patients, mass casualty incident, vehicle versus pedestrian. 91.
Last week's car crash at Oak Mountain Amphitheater left 10 people injured and 3 dead. Caring for this volume of emergency patients creates special problems. So how did paramedics know where to take each patient, and how did hospitals know to prepare?
When paramedics arrived on the scene, they had a special resource unique to Metro Birmingham, the Trauma Communications Center operated by BREMSS, the Birmingham Regional Emergency Medical Services System. This high-tech center coordinates the real-time availability of area hospitals with each patient's unique needs. It also monitors Central Alabama to provide advance warning of bioterrorism. The Trauma Communications Center, also called the TCC, was notified of the incident before emergency personnel arrived. Upon impact, the car's OnStar automatic accident crash notification system immediately transmitted crash information to OnStar and to the TCC. When paramedics arrived, they notified the TCC this was a mass casualty incident.
91 command to control. Go ahead and initiate a mass casualty incident. We've got 10 plus patients.
Using a private radio network, the TCC notified hospitals in the 6-county region to prepare to potentially receive patients. As paramedics treated patients, they worked with the TCC and made informed decisions about which patients should go to which hospitals. The most seriously injured patients were sent to Level 1 hospitals, the less serious to available Level 3 hospitals, and walking wounded to community hospitals. Another unique thing happened Friday night. Unconscious patients shared medical information with medics. These patients had previously registered with the Blue Cross and Blue Shield of Alabama Emergency Patient Information System, which is electronically connected to the TCC. Another chapter of this story, unknown to anyone at the time, was the car crash released a dangerous biological agent. The TCC electronically monitors each hospital's readiness to receive patients. This is called the Hospital Divert System. At the TCC, the divert system is linked to a biological chemical terrorism monitoring process. Patients unknowingly exposed to the biological agent later developed a harsh skin rash. A day later, one hospital after another went on divert from the influx of these patients. The TCC's LifeTrack system monitored this change, generated early warnings, and then electronically requested additional information from all hospitals. With this information, the TCC notified public health and emergency management entities sharing information across county lines. These entities began determining what the agent was, appropriate patient care, and how to prevent the spread of the illness. Each year, BREMSS TCC routes over 2,600 trauma patients, 1,200 stroke patients, and dispatches over 1,500 lifesaver helicopter flights. In the last year, BREMSS TCC routed over 100 national disaster patients from Hurricanes Rita and Wilma. The unique system efficiently moves from supporting a one-patient scene to a mass casualty incident. This system has many faces. Some of those faces are those who are alive today because of the BREMSS TCC system. Chris Osborne, a local media expert, is one of those faces.
It's not every day that a news reporter actually becomes a part of the news. On July 15, 2004, I was struck by a hit-and-run driver while riding my motorcycle, and I have to say that the BREMSS TCC system was a lifesaver. I had no idea that my leg was severed so badly that it would have to be amputated. Having that technology right here in Birmingham, Alabama is such a great resource. Knowing that the helicopter lifesaver was on standby, having the ambulance there immediately, going to a level 1 trauma center, those resources were invaluable. And I am so happy that there is a service here in this city that covers the entire region that will help people beat those life-changing, life-altering situations that could actually lead to death.
Another face of this system is Ashley Oliver, a local fitness expert and bodybuilder.
My wreck was responded to in such a timely manner that I think it kept a lot of damage from happening, maybe even death, probably even death. I do see that some hospitals are better equipped to deal with different types of injuries, different kinds of patients, and I feel like that if this system was not available for me the night of my wreck, I may have been sent to the closest hospital, which may not have been the best hospital for me to go to. The doctors were there waiting for me. I don't think if it had, been a few more minutes, I don't think I would have lived.
Homeland security is a complex challenge and radically different from the Cold War and military defense problems of the past century. The threat is multidimensional and rapidly changing, and the need to develop capabilities is urgent. The front lines are in our communities, and the solutions to this new challenge start and end there as well. BREMSS meets the criteria and deserves to receive recognition for innovation in Homeland security. It is Mitretek and Harvard's hope that the best traits of this program will be replicated as a best practice in Homeland security and adopted in communities around the country.